I think one of the most challenging things in third year is going from words to people. And what I mean is, unfortunately, through basic sciences, you're forced into a construct to where you have to use buzzwords. These buzzwords are still words. And telling me there's a Reed Sternberg cell and then getting to third year and telling me here's a peripheral smear, find one, is a very different thing, right? I know the word Reed Sternberg, I know the owl eye, whatever, but it's very different if you're like, here's a smear, like, what do you want to do with it, right? So for third year, the construct or the concept needs to be, let's move from words to people, to images. And I think that's a big thing when you're studying for these shelves is you're so used to finding these buzzwords. Sometimes you need to stop and look at the patient. So here's a good example. Let's take a look at this. All right. Here's our famous little Asian child that comes in with a fever for over 5 days. What could it be? It's got to be Kawasaki's, right? Well, great. You know what? When the mom comes into your office, she's not going to tell you the kid's had a fever for 5 days. Here's this nice rash. It's not going to be presented to you in this sort of way. The kid might not even be Asian. Who knows? It's not the point. The point is the mom's going to come in and be like, he's got a fever. It won't go away. Okay, that's not going to give you a red flag that it's Kawasaki's, right? You're not going to get this. It's been 5 days buzzword. The point is, when this little child walks into your office, you need to be able to look at him and be like, him or her, and look at that child and be like, I know this picture. I've seen a cartoon of this picture. These are not buzzwords. This is imagery. This is what I'm looking at. When you read these questions, you should move from buzzwords to seeing these pictures, okay? UWorld does a great job of integrating these images, and if you take just a few more seconds and just just look at these pictures for 30 seconds as if you were looking at the Mona Lisa. Just give it 30 seconds, right? Just give it 30 seconds. My guess would be that you were more likely to remember the constellation of symptoms there. That little Kawasaki's picture in UWorld is burned into my brain. All the symptoms. It's just burned into my brain. If a kid comes in years from now and I see it, I feel like I'd recognize it because I have that image. It's not buzzwords. I put the picture to it. And I think that's what third year is about. Read these questions and put the picture together. It'll help you solidify your thought process clinically. And quickly, I want to go back and look at the question because people are going to say, well, how in the world would you get lymphocytic myocarditis as an answer here? Well, look, first of all, you have to diagnose the kid with Kawasaki's. Now, I know these still have buzzwords in it, but I'm telling you for clinical medicine, if you move from reading these words to seeing it as images in your head as a picture, it will start making things easier. You need to start seeing patients instead of words, okay? So for the people that are going to say, well, how in the world would you get lymphocytic myocarditis? Well, first off, you have to diagnose the kid with Kawasaki's disease. Don't skip the age. I know I do it a lot, but if you look at the age, you can eliminate all of adult medicine very quickly, right? First. Now, let's assume I did not know. I did not happen to read lymphocytic myocarditis. How could I possibly look at these and maybe deduce it? Well, I know when I look at this kid with Kawasaki's, if I was to, as you know, I color code my notes, green, yellow, red, if red is the most important. If I was to have an image of this kid, that area of the heart, that myocarditis, those vessels that we are worried about with aneurysms, those would shine bright red. That is my main concern. The rash, sure, green, yellow, it's a concern, but glowing in red is this child's heart. We need to be concerned about it. Okay, so let's go back to the question. AVMs, I don't know, kind of valvular or vascular, but whatever. I mean, maybe. Bacterial, I don't know. It's more like an autoimmune thing. Eosinophilic, I don't know. It doesn't really sound rheumatic. That's again infectious, but lymphocytic. Let me tell you, I do know something. I do know that when you treat these kids, weirdly, you give them aspirin and IVIG. Now, IVIG You're working on immunoglobulins. So if I had to guess between these two, I'm leaning towards the T's and B's here. So look, again, it's deductive reasoning here. Is it going to work every time? No, but I'm just saying the point of medicine is not to tell the mother your kid's going to have lymphocytic myocarditis. The point is for you to be able to diagnose this and get them to the appropriate person that knows what they're talking about, right? Okay, so start thinking like this. It'll make your life easier, I promise.